Good evening. This is All India Radio Kohima. I'm Jonas Yantan with Evening News. The headlines. Prime Minister Modi leads nation in paying tribute to brave hearts at National War Memorial on 50th anniversary of Vijay Diwas. Government says protocols for management of any adverse reaction due to coronavirus vaccines have been established. Nagaland COVID-19 cases surged to 11,787 with detection of 26 fresh infections, while 23 patients' recovery keeps active patients at 594. And School Education Department Nagaland asks Institute Nodal Officers to be cautioned against fictitious application for scholarship. Prime Minister Narendra Modi paid tribute at National War Memorial this morning on the 50th anniversary of the 1971 India-Pakistan War. Vijay Diwas is observed every year on December 16 as a mark of victory over Pakistan in 1971 war that also led to the creation of Bangladesh. On this momentous day 49 years ago, over 93,000 Pakistani troops under the command of Lieutenant General Ark Niazi raised white flags and surrendered unconditionally at Dhaka in the presence of the three tri-service theatre commanders of Indian Armed Forces. It was on this day in 1971 that the declaration of the ceasefire was brought into force, ending the Indo-Pak War and resulting secession of East Pakistan to the sovereign country of Bangladesh. On the occasion, Defence Minister Rajnath Singh unveiled a logo for Swarnim Vijay Varsh to mark the anniversary of the war. He saluted the bravery of Indian Army on Vijay Diwas. In a tweet, Singh said the soldiers wrote new chapter on bravery. He said their sacrifice evokes inspiration in Indians and the nation will always revere them. Government has said that protocols for management of any adverse reaction due to coronavirus vaccines have been established. Health Ministry officials have informed that possibility of few adverse reactions post-immunization cannot be ruled out. It said the guidelines for managing such minor, severe or serious events have been included in the vaccination drive guidelines. The officials informed that in accordance with these guidelines, limited number of vaccinations will be administered in each immunization session. Post-vaccination 30-minute on-site monitoring of people has also been mandated as per these guidelines. The Health Ministry has asked states and union territories to prepare for such events and accordingly set up at least one adverse event following immunization AEFI center in each block. Additionally, primary health care facilities, community health centers, and private medical facilities would also function as AEFI management centers in the states. The COVID-19 vaccine will be offered first to healthcare workers, frontline workers, and persons above the age of 50. This will be followed by vaccination of persons younger than 50 with associated comorbidities and then to the remaining population based on disease epidemiology and vaccine availability. The first meeting of Nagaland State Task Force on COVID-19 vaccine held in Kohima yesterday deliberated on rollout of the vaccine for the first phase and the role of all stakeholders in the statewide campaign. The meeting has issued broad guidelines to be followed for the first phase vaccination of healthcare workers. The first phase will be planned in health units with cold chain points as fixed session sites, while in urban areas with high caseload, sites without cold chain can also be included to avoid crowding. Informing that session sites will be clubbed as per line list of beneficiaries, the STF said PHCs with low beneficiaries can be clubbed accordingly to minimize wastage, taking into account cost and feasibility of transport. All districts have been asked to submit line list of all session sites with beneficiaries and names of 5 vaccinators for all sites on or before 4th January 2021. The national COVID-19 recovery rate has improved to 95.21% in the past 24 hours. With 33,813 new discharges, the total discharged cases reached 94,56,449. With 26,382 new COVID-19 cases in 24 hours, India's total cases have gone up to 99,32,548. Health Ministry said with 387 new deaths in 24 hours, the death toll has reached 1,44,096. Total active cases are now over 3,32,000. This news comes to you from All India Radio, Kohima. Nagaland's COVID-19 tally mounted up to 11,787 with detection of 26 fresh positive cases today. Health and Family Welfare Minister S. Pangyupom in a tweet said 11 cases were detected in Dimapur, 5 each in Kohima and Mokokchung, 2 each from Beren and Mon, and 1 in Pek district. Besides, 23 patients have recovered from the infection, which included 14 in Kohima, 6 in Beren and 3 in Dimapur. Presently, 10,993 have recovered, while 594 cases are active. Following a COVID-19 infected patient's demise in Dimapur, the death toll has increased to 73, out of which 7 are due to comorbidities and 3 are being investigated. Altogether, 127 patients have migrated to other states. Principal Director School Education Nagaland, Shanavas C, has informed that many people with vested interest are applying for scholarship under fictitious name, which is a serious crime. Therefore, the Department of School Education once again requested Institute Nodal Officers, INOs, to be cautious while verifying the student's application form. He said the INOs responsible for the first level verification are required to maintain copies of supporting documents prescribed by the ministry year-wise and produce the physical record to the district nodal officer and state nodal officer as and when required. Meanwhile, the department has also informed that the central ministry has extended the National Scholarship Portal for applying online scholarships for 2020-21 with 31st December 2020 as last date for submission of online applications by the students. The Supreme Court today said it is mooting the formation of a committee to hold talks with the agitating farmers and settle the matter amicably. A bench comprising Chief Justice S.A. Bopre and Justices A.S. Popana and V. Rama Subramanian said the panel will have members of Paradia Kisan Union, Government of India and other farmer organizations. The court was hearing 2 petitions seeking removal of farmers protesting at the Delhi NCR borders against the recently passed Farm Acts. The Apex Court has issued notice to Central, Haryana, Uttar Pradesh. Delhi can impede the organizations and unions representing the protesting farmers. The case will be heard again tomorrow. Continuing the Beauty with a Purpose Project Phase 2 of Miss Nagaland 2019, Wokha District Administration and DLCW MSK under Beti Bachao, Beti Badhao in collaboration with Beauty and Aesthetic Society of Nagaland organized an awareness program on livelihood generation and education at DC Conference Hall, Wokha yesterday. Speaking at the event, Miss Nagaland 2019, Vikonyo Sachu shared her experiences of working with the local farmers, especially during the COVID-19 pandemic and the demand for local product by the people of Nagaland. Dwelling on the positive aspect of farming, she encouraged the participants to buy locally produced products to motivate them to carry on with their farming. And as the nation fights COVID-19 pandemic, let us all remember to stay safe and protected by following these 3 simple steps. Wear a face mask, wash hands frequently with soap and water, or use hand sanitizer and follow social distancing norms. And now 20 news, here are the main points again. Prime Minister Modi leads nation in paying tribute to brave hearts at National War Memorial on 50th anniversary of Vijay Diwas. Government says protocols for management of any adverse reaction due to coronavirus vaccines have been established. Nagaland COVID-19 cases surged to 11,787 with detection of 26 fresh infections, while 23 patients' recovery keeps active patients at 594. And School Education Department Nagaland asks Institute Nodal Officers to be cautioned against fictitious application for scholarship. That is all we have in this evening news bulletin. Good night.